and good afternoon, everyone. A very warm welcome to our Doc Talk by Eddie MC in Facebook Live. I am Dr. Noraza, Consultant Ophthalmologist, Pediatric Ophthalmologist and Strabismus Surgeon from Damansara Medical Center. It is an interesting topic today. It's about COVID-19 infections and children in Malaysia. Let me introduce you, our guest speaker. Today we have Dr. Rakhee with us. She is the resident consultant pediatrician, head of Department of Pediatrics, members of Medical Advisory Board, and members of our COVID-19 Task Force Committee in Damansara Medical Center. She's also an executive committee member of Malaysian Pediatric Association. She's a Pediatrics Doctors Ambassador with Docuity Malaysia and also regular speakers at various local and international conferences, workshops, webinars, radio, newspaper, and magazine for various pediatrics-related topics. Welcome, Dr. Rakhee, to our talk today. Dr. Rakhee? So basically today we are going to discuss an interesting topic. It's about COVID-19 with children. So it's very interesting because we wanted to know how many children are affected by COVID-19 infections in Malaysia. So we wait for Dr. Rakhee to come in for a while. I think it's very interesting things and you had to prepare if you have any question regarding COVID infection in children. Right, Dr. Rakhee, you're on. Hi, Dr. Rakhee.
Sorry about that glitch just now. Accidentally pressed the wrong buttons. Hi everyone, I'm Dr. Rakhee, Consultant Paediatrician. Thank you so much, Azza, for that kind introduction. Yes, I will be talking about COVID-19 infection in children and vaccination options for them. So just to be clear, United Nations Convention of the Rights of the Child has defined a child to be an individual below 18 years old. So for the context and purpose of our discussion today, whenever I mention a child or children, it will be for anybody that is below 18 years old. So Azza, this time last year, we were not so worried about children getting infected, but all that has changed. My children have not even been to physical school for almost a year or even stepped outside our house for the past few months due to the EMCO. We live in Klang Valley, so the EMCO has been the third lockdown has been quite strenuous for us. What about you, Azza?
Well, I myself have 4 children and I'm worried about them getting COVID-19 infections.
Absolutely.
But we often hear children were not affected as bad as an adult when it comes to COVID-19 infections. Well, Dr. Rakhee, can you tell me what are the symptoms and what will happen to them if they contracted this infection?
So we do know that a majority of children remain asymptomatic, or they have mild symptoms like a bit of fever, some cough, runny nose, and some children might have a little bit of a tummy upset like diarrhea, vomiting. A few of these actually progress on to more severe symptoms like difficulty in breathing. They may have bleeding tendencies, the heart might beat much more faster, they may have palpitations, and a smaller proportion of these actually go into multi-organ failure or develop MISC, which is what we call multi-system inflammatory syndrome in children. This is a very rare condition that happens 4 to 6 weeks after an infection, usually an asymptomatic infection. So it's something that we need to look out for children. They develop inflammation in various organs and subsequently a few of them succumb to the disease. Some of the red flags that I want to put out here would be difficulty in breathing, severe lethargy, poor feeding, and a fast heartbeat. So if you see your child having any of these symptoms, do take them to the nearest emergency and seek treatment early. Don't wait at home. Don't think it's just something simple. Seek treatment early.
Yes, children get sick sometimes, Rakhee. How do you differentiate COVID-19 infection with the usual cough and cold?
Well, that's a good question. And it's actually quite difficult for us as pediatricians or even doctors out there, general physicians, to differentiate them. Symptoms may be very non-specific and sometimes they may mimic each other. Like if someone comes in with a fever and a cough, whether this is a common cold or whether this is COVID-19, it's quite difficult for us to know. So I would say, look at the timeline. Look at any positive context. look around the area. If someone in your community has had positive contact, and you may have come in, especially those who live in apartments, it's close confined areas, there's a general usage of lifts, playgrounds. So if you feel there's any positive contact from work, then it is necessary to do a swab test to confirm whether this is COVID-19 or whether this is common flu. I'm going to take this opportunity here to mention that a swab test can be done from newborn onwards. So there is no particular age that is, like some people say you only can do it at a certain age. No, it can also be done at a newborn onwards. And for parents who have newborns, please make sure that you limit your visitors to them in the first few months. Also make sure that those who actually visit your newborn baby are fully vaccinated, not just a single dose, not just completed the second, but fully vaccinated, which means completed 2 doses 2 weeks later. So limit visitors to your newborn baby and keep them at home as much as possible, unless they need to go and see a doctor for their well check. Yeah, Azza?
Yes, for the young parents, this is good for the young parents. How do you tell, let's say babies less than 1 year or infant, how do you tell if they have COVID infection?
Like I mentioned, very non-specific. So below 1 year old, it's very difficult because compared to an adult can come to the doctor and say, I've got a headache, I've got a fever, I don't feel well, I've got a sore throat. But an infant or children below 5 years old have difficulty in communication. They may present with very simple findings, or sometimes just one episode of a diarrhea, sometimes just vomiting, and that could also precipitate into they could actually be having COVID-19 because of these small symptoms. So it's difficult. So I would just tell parents to keep a lookout, make sure you know what is normal for your child, and then you will easily pick out what is abnormal.
All right. Now we see the numbers of COVID-19 infections are alarming and increasing every day. But do we know what is the rate of infections among our children? How many of our children get COVID-19 infections so far?
Okay, so first of all, I'm going to say that Ministry of Health data is very limited to the public. Initially, the number of cases were very low. If we all recall, the first wave in end of 2019 to 2020 only had 22 cases. Then the second wave hit, and that number rose to 10,000 cases. Subsequently, we're in our third, fourth wave, and it's gone up to 900,000 cases. That's a huge jump in numbers. And Malaysia has one of the highest case numbers in the Asian countries. Our current R0 is actually 1.1 and above. So these numbers are really alarming. But what about children, like you rightly asked? The number of cases till date, the only data I have is until the 29th of June, is actually 116,378. Worldwide, that is 4 million children that have been affected with COVID-19. And in Malaysia, the ages that they break down in is 13 to 17, 37,000 cases, 7 to 12 years old, 38,000 cases, 5 to 6 years old, 12,000 cases, and the newborns to 4 years old, 29,000 cases. So it just goes to show that the children are affected at every age from newborn up until 17 years old. So now you're going to ask me, what about the death rate? Should I be worried? Yes, the mortality rate or the death rate is actually very small, 0.5%. But if you're looking at numbers that are so huge, that number doesn't really make a difference if that one child that dies is your own. Overall, worldwide, 600 children have actually died. So the death rate in adults is about 0.9, almost 1%. And the death rate in children is actually half of that, which is about 0.5%. Worldwide, 10% roughly of those who are infected are children. But in Malaysia, that number has doubled to slightly more than 20%.
Wow, Rakhee, 20%. I think it's a huge number.
It's a huge
number. Yeah, it's a huge number. Now, the World Health Organization has reported that the current increasing numbers of cases worldwide are due to the COVID-19 variant, and more than 24 countries have epidemic curve becoming vertical. Are these children more susceptible to this variant, Rakhee?
Okay, so before we talk about susceptibility, I'm going to tell you what variants are. Everybody's going to say variants. The term is being used right, left, and center. So what are variants? So variants are basically viruses. They mutate. That's just what they do, right? So every time they enter a host, they will make copies of themselves, and sometimes there's a defect in the code, and that leads to mutations. Some mutations cause the virus to self-destruct. That's Azza, what we are all hoping for. The virus will
Yes.
self-destruct and disappear. But unfortunately, some of these variants cause them to be much more nastier. So the longer the virus circulates in a population, the more variants will be formed. So why are we so worried about variants? Variants cause the disease to be more severe. They have higher transmissibility, which means they can transmit from one to another. If anybody was following what the DG said, the Delta variant can transmit within 5 seconds compared to previously. We were all thinking it only takes a few minutes before they can actually transmit. So they have higher transmissibility. We know that because of the severe disease, the hospitalizations and the ICUs are much higher. And unfortunately, the response to treatment or the effectiveness to treatment and vaccines are reduced if you are infected with a variant of the COVID-19. There are two different types of variants. One we call the variants of interest and one that we call variants of concern. Variants of interest are the ones that usually have propensity to develop into variants of concern, and variants of concerns are the ones such as alpha, beta, delta. Delta, I'm sure a lot of us know about that, and gamma. So children are susceptible to variants, as those below 12 years old cannot be vaccinated as of now.
All right. A while ago, we see, we started back to our new norm, right? And the school will open. And we started to see small clusters emerge everywhere. And well, fortunately now, we see many teachers have received their vaccination. And maybe the school will be reopened soon. Now, letting our kids out, are the children the main spreader of this disease?
Well, I can safely say that children are not super spreaders. They can spread the disease. But there was a recent study actually done locally, published in May 2021 in the International Journal of Infectious Disease, which actually showed that the transmission from children to uninfected guardians in isolation was very minimal, right? This has also been described in 2 other studies. So I have a lot of parents who actually say the child is positive, but we are negative. So does that mean I can get it to my children? So this is a very encouraging results from a local study that actually showed that transmissibility rate is very small, provided you practice the SOPs that we have in place, like masking, washing your hands, following isolation measures. So they are more vulnerable. Children are more vulnerable because more adults are being vaccinated. So we now know that older children also mimic in terms of their immune response to an adult. So that's why it is very important for us to vaccinate the teens and the adolescents as soon as possible. Because not to say that they're super spreaders, but they mimic the disease profile of an adult.
Right. Well, as we prepare our kids for future lifting of the NCO, getting back to our new normal life, how can we prevent children from getting infected with COVID-19?
Well, similar to adults, whatever public health measures that we have in place still applies. All right, and then the DG, I think, has been mentioning this since the beginning of the pandemic. Avoid 3 C's. So what are the 3 C's? That's closed spaces, confined spaces, and close conversations, right? Practice the 3 W's. Wear a mask, wash your hands, and watch your distance, right? Also, get vaccinated. To those who can get vaccinated, get yourself vaccinated. The only difference between children as well as adults is that they need a little bit more regular reminders. They need more supervision, especially for the younger ones. They'll follow you whatever you say. If you tell a 3-4-year-old, please wash your hands, they'll wash their hands, but they need to be reminded. So don't expect a young child to remember these SOPs. It is our duty as a parent, as an adult, to make sure that they follow these SOPs that we have in place for their safety and for reducing transmission. You also, I think, need to explain to these children why they need to maintain these SOPs. Don't expect them to just follow blindly. Like some kindergartens before the pandemic, my children used to go to a kindergarten and the teachers there used to have a hand hygiene day. Let's all learn about washing our hands. Let's sing along, and teach our children, okay, happy birthday to you, that 20 seconds and we clap in our hands and we wash our hands. So teach them, encourage them, praise them, do all these measures that so the child is not just feeling, I'm just blindly following whatever mommy tells me to. I'm just doing whatever they say, but I don't know why I'm doing it. So, a gentle reminder, a little nudge in the right direction helps a lot with children.
Good, Dr. Rakhee. I agree with you. You have to make them understand. Then only everything makes sense, right? Now, I heard some countries have started vaccinating school children, right? Can you tell me what are the available COVID-19 vaccine for children?
Okay, so in Malaysia, for 18 years and above, we know we have the Sinovac, the Pfizer, the AstraZeneca, the Johnson & Johnson, and the CanSino Bio. So many options for adults. But for children, we only allow for 12 years and above at the moment, 12 years and above, the Pfizer vaccine. All right, so if you register your child who's 12 years and above, they will be given the Pfizer vaccine and no other vaccine at the moment, right? However, I'd just like to put a little disclaimer here that the priority is still being given to elderly, to the workforce adults, to those who have immunocompromised diseases, for adults who've got diabetes, hypertension. We still want these group of people to get the vaccine as soon as possible, and hence why the delay in vaccinating children. But we should remember that children who have high risk, such as children who have underlying diseases, children who have comorbids, children who also have immunocompromising diseases, these are the ones that we definitely need to make sure they're registered and they are a priority to get the vaccine as compared to normal children. So if your child has asthma, if your child has a lung disease, kidney disease, you definitely want to key that into the system and get them registered as soon as possible.
Okay, good. Well, when we talk about vaccines, people are worried about the side effect, Rakhee. So are there any serious side effects reported so far in children after COVID-19 vaccination?
Okay, so nothing in life comes for free. You know, we always say that, right? So what are the side effects? First of all, a side effect from a vaccine does not last more than 72 hours. It's usually happen within the first 24 hours. You'll feel something. You will feel it within the first 24 hours, but a maximum of 72 hours. So I always tell my patients, I always tell the parents, just hang in there the first couple of days, 2 to 3 days. And a lot of times they don't even feel much because they're already anticipating something's going to happen, but nothing happens. And they're like, hey, that wasn't so bad. You know, so the first few days, 2 to 3 days, that's the duration of side effect of vaccines. So when you know a symptom is persisting for more than 4 to 5 days, then seek treatment at the nearest emergency because it could be something completely not related to a vaccine. So what are some simple side effects? That would be fevers, sometimes you feel lethargy. I felt very hungry. When I got my first and second dose, I was famished. I just wanted to eat everything that I came across, so I was very hungry. So hunger is something that you might see in your children as well because they're more young, they're more robust. Sometimes you feel soreness over the injection site, so we usually recommend getting the vaccine on the non-dominant arm. Someone asked me, can I lie down and get it because I'm a bit needle phobic, I'm afraid I'll fall down? Of course you can. Just let the nurses know at the vaccine center so that you can lie down, a child can lie down, so that, or you can cuddle your child, you can let him sit on your lap, especially if you have smaller sized children, 12 years old, they're a little bit big already, but I do see some small size 12 to 13 years old. You can sit with them, you can let them lie down, let them get the vaccine in the most comfortable position. Also to mention that we have calm rooms in certain vaccination centers. So if you have a special child, these children can be vaccinated in calm rooms that doesn't have all the surrounding fuss and chaos that's happening. So that's an option for these children. And one of the most rare complication that a lot of people have been putting up on social media is myocarditis or pericarditis. So what is myocarditis? It's basically an inflammation of the heart muscle. Let me stress here that it is very, very rare. It happens in 12 cases per million. That's 0.0012% chance of you getting myocarditis post-Pfizer vaccine or mRNA vaccine actually. And this usually happens in boys, older age. We usually see them at 16, 17 until about 30 years old. And it happens 4 to 6 days after the second dose, right? So I'm going to stress here once again that myocarditis is very, very rare. But this is one of the reasons why they recently announced that if you have your vaccination, don't do strenuous activities for 1 week post, because you just don't want to stress your heart. Having said that, COVID-19 itself can damage not only the heart, but so many other organs. So myocarditis is so rare, but COVID-19 isn't. So when you weigh the risk versus benefit, when you're talking about a rare side effect like that, I would definitely err on the side of benefit because at this point, there's so many COVID-19 cases that I'll be so scared to get infected rather than risk something that is 100% of the time, nobody has died of myocarditis. They recover 70 to 80% of the time. They're actually asymptomatic. They have just a little bit of uncomfortable feeling, and they recover without any medication. So, something as simple as that should not make you be very scared to get the vaccine.
All right. Well, okay. Now we know that children are stressed being locked at home during this pandemic. They are eager to go out. Any tips to keep our children safe during this pandemic, Rakhee?
Unfortunately, the first tip I'm going to say is still to stay at home, especially if you're in Klang Valley. Please don't go out. Please don't mingle around with other children just as yet. If you have a single child, that's really difficult. But as a parent, we spend more time with our child at this point. If you have multiple kids, 2 or more, it's a little bit more easier because the kids tend to, find things to do amongst themselves. But reduce mixing around, reduce the usage of common items, all that. So stay at home as much as you can. We've got to encourage our children to wash hands frequently. And those who can get vaccinated, please get that done as soon as possible. Register yourself and make sure all the details are accurate. I'd also like to take this opportunity here, Azhar, to mention a little bit about mental health issues in children, because that is one of the that's not being mentioned very much. A lot of our children are undergoing pandemic fatigue. They're undergoing a lot of pandemic stress. And we just don't pick them up because we think, it's only adults that gets mental health issues. It's only adults that have depression or anxiety. No, children can have it too. And they can get depressed. Children can get anxious. Children can be much more hyperactive. So if you didn't have a hyperactive child before this, all of a sudden your kid's jumping around your house, tearing apart your sofa, playing with your pets roughly, because this happens when you take away something from a child, when they could go to the playground and release all their energy. Now that's gone. I'm telling you to stay at home, so I've got to stay at home. What do? Climb up and down the stairs, try to jump from the top of the stairs to the bottom. I'm creating some sort of avenue to release my energy. A child may actually go inwards. So someone who was previously very active and all that, suddenly they will start being very quiet, they'll start being very sad. They'll say, I just don't feel like eating, poor appetite. So these are certain red flags that as parents we've got to put in our mind. Is my child okay? Is there something wrong with my child's mental health? Give them the support that they need. I've got a little tip for parents out there with regards to this, and that's basically to create a schedule. What I mean by creating a schedule is basically finding them alternative ways to be occupied. So I've done this in my family as well. I've created gadgetless hours. So between 5 to 7 in the evening, no TV, no iPad, no gadgets, no phones, no except when I'm on call.
What do you do?
No laptops, nothing. So mine, ping pong, or what they call hopscotch. I just take a chalk and I draw on the floor, hopscotch. Put them in a swimming pool, get the balloon swimming pools, put them in there, let them run around the car, chuchi my creator, wash my car, have a board game night. If you've got bigger children, have board game nights, so buy different board games for different nights, and that's when you realize that it gets them to improve their vocabulary. It gets them, especially if you're playing Scrabbles or if you're playing Jenga, it can reduce their stress levels and all. And also for the little children, organize maybe treasure hunts. You don't have to wait for Easter to hide the little bunnies. Hide the little chocolate pieces, and since Mama's hide a few things, would you like to go and treasure hunt and find it? For the older kids, you can create a treasure map, behind the sofa, near the kitchen, underneath the living room table or something. So create a fun activity for the kids, age appropriate wise, and see if that works. Also, I love traditional Malaysian games, like Batu Seremban, we call it, the 5-1 minute. So have Batu Seremban, have Congkak. I have a Congkak board at home. These are all very traditional but worthwhile games that takes these children's mind off a lot of other things. If they're stressed with work, for instance, school, homework, assignments, exams, this can take them off because you've created some sort of schedule, some sort of alternative way for these children to release their energy. You can even have like an art day for the younger kids. Okay, today is art day. Let's play around with whatever art that you want. Do you want watercolors? Do you want crayons? You can even have sports day. So if you have more than one kid, of course you can do this. There was a recent video online that they showed this father. He created an obstacle course in his own house using pillows, using cardboard boxes, and just marking out a chalk outline on the floor. That can be very nice for children to keep them occupied. So these are just a couple of personal tips for me for parents of different ages to handle children, especially if you are working from home and you're struggling to, just going through the whole pandemic stress together. We're all fatigued, but these are just some of my personal tips. Hope it helps.
Yeah, that's a wonderful tips, Rakhee. This is the best time to bond with the children, right?
Absolutely.
Most of the time, we think that we don't have time. We're too busy with the work and we don't have time. And this is the best time actually to bond and to know your children more. Now, well, thank you, Dr. Rakhee. I think we have come to a question and answer session now, right? Okay, I have a question here from Eva Karina. What are the most important measures to prevent the spread of infection in school?
Oh, that's a very good question. I actually anticipated that because so many of my teacher friends and principal friends all mentioned this. So basically in school, we need to have a sustainable strategy with science-based approach to mitigate and contain the outbreak. All right, so what that basically means is in school, COVID-19 has put basically 1 billion children out of school. Did we know that? No. It's something that is alarming. 1 billion children are out of school. Yes, and out of this, 4 million children means that they have missed out on a decent meal and have no access to that one free school meal. This is an educational crisis, right? It is important for us to maintain SOPs. So the usual SOPs are in place, and there are so many things that we can actually do. The Ministry of Education will be releasing guidelines to address this very, very soon. And they basically comprise of 5 key components, which is basically a healthy policy, healthy building, a healthy classroom, healthy schedules, and healthy activities. All right. So some of the schools can adopt certain measures. For instance, masking. We would recommend all students, all staff, everybody at every level, even visitors who visit the school, to be masked up with the right mask. So whether they're double masking or whether they're wearing the KN95, with the right mask, and children should be trained to wear and care for the mask the right way. So don't just discard mask here and there. We don't want environmental pollution to happen. So wear and care of the mask should be explained very clearly to them. Washing hands should be a regular routine. Providing hand sanitizers at every entrance and exit of each classroom, every entrance and exit of the school areas, and this all over the school, in front of the halls, bathrooms. We should encourage children to use this at every time, and constant reminders from the teachers should be there. Providing hand sanitizers is good. It'll be great if they can bring along some to their classroom as well. Physical distancing, we actually recommend 3 feet between people as much as possible. So whether that person is a child or whether that person is a teacher. So this is also recommended even in the staff rooms. The teacher's staff room, we should also maintain that distance of at least 3 feet from each other. We should have more classroom outdoors if that's possible, because ventilation is a huge issue as well. And we want to make sure that they get as much outdoor air as possible. Replacing hugs and high fives. This is something that it's a personal tip of mine. Replacing the hugs and the high fives with a smile, a wave, or a thumbs up. So we teach the children that you can still connect, but you connect without touching. So they still stay safe and they can still do those measures. So rather than touching each other, a smile, a wave, or a thumbs up. That helps children connect with each other, even though they have to maintain physical distancing. Minimizing group gatherings. So not allowing huge classrooms to mingle between each other, reducing movement between classrooms or the teachers moving between classrooms. That will be beneficial. Limiting sharing of objects. So as much as possible, provide individual supplies for children and encourage them to bring their own supplies if possible, like crayons, color pencils, their own pencil box and things like that. Manage school timings or school movements. So staggering arrivals or departures, setting up separate entrance and separate exits. These are also important because you don't want a crowd and, you maintain strict SOPs. At 3 o'clock or 4 o'clock when school is over, there's a huge crowd outside, and all of a sudden you've got 1,000 people all in the same place. So that's one of the blunders that happened in the past couple of months when schools suddenly reopened without proper policies, without proper SOPs, and everybody was confused. Should we just go back to school, not go to school? What should we do? Should we send to school? So these are just a few more tips. Meals should be held in classrooms as much as possible. Avoid meeting in huge halls like canteens during recess time. Stagger the recess time if you don't have a place in the classroom to eat. Stagger the recess time so you have less amount of people who are gathering together during meal times. Keep the meal times short and sweet so you don't exaggerate 1 hour without wearing a mask. Encourage the children to wear back their masks as soon as they're done with their meals. And providing packed meals is actually safer rather than buffet style, then they'll be just grabbing and people be lining up and then your physical distancing is gone there. I would also like to mention here that it would be good if kids could bring their own utensils like fork, spoon, and straw if that's possible, so to reduce the plastic usage. So we'll be a little bit more environmental friendly. And transportation, so a lot of kids, including mine, they actually go through transport. So in the vans, cars or buses, keep your windows down, let cross ventilation happen. So we want all of these to actually go on so that children feel safer. Reduce the number of children in that transportation, right? So that's also important. And finally, I think schools at this point should allow some sort of hybrid learning as an option for some children who maybe cannot go back to physical classes. Maybe they have underlying diseases, maybe they have underlying issues that they cannot go back to physical classes. So allow hybrid options. One more aspect is for schools to come up with a COVID response team. Not all schools have a nurse, but they should allocate one teacher or two teachers to be a part of this team, and you should have a standby doctor, maybe a nearby GP or somebody that can link with the school so that that if anything happens, these would be the people that you want to connect with, and you have a team on standby. So if a child is sick, what's the protocol? What should I do? If a child is sick, you're not allowed to go to school. If you are found sick in school, what should we follow? The steps all should be there. So I think that would be a good addition to all the measures that I've already mentioned, having a COVID response team in each individual school. You don't need to have a doctor or nurse on standby in the schools, because as I know, a lot of the government schools don't have that, but at least have a number of a nearby clinic and the nearby hospital so that that in case of emergency, these are the two numbers that you're going to be able to call. So those are my tips for schooling.
Okay, wonderful. Wonderful tips, Rakhee. I love that. I love the fact that they won't have any more perhimpunan pagi,
Yeah, we all dread the perhimpunan pagi.
You sing and then people... teachers are talking.
But my kids do online class and they still stand up at Negaraku, so I'm very proud of them when they do that.
Oh, that's wonderful. They're so good.
We still have talks by the principal who encourages them that, hey guys, hang in there, we're all in this together, teacher misses y'all. So I love that aspect of my kids' schooling, and it's a wonderful thing to see. So in a way, perhimpunan not so long, but maybe 10-15 minutes is good to get the kids also back in, mingle around, that sort of thing. Yeah.
All right, we move to the next question, Rakhee. It's from Gordon Isaac. What are the tips and tricks to promote hand washing?
Okay, I think I touched a little bit on this earlier. Sing along, putting up cartoon pictures, maybe for the kindergartens and early educator centers, you can put up a cartoon infographic above your sink that actually, there's so many online that actually teach a child what aspect of the hand to wash, whether it's, both the hands, and then you wash this part of the hand, don't forget your wrist, don't forget your thumb, so they have that infographic you can put in a cartoon way, and you can have a song, maybe you can come up with a hand wash day where you have cartoon, you can have art drawing, or you can have, all these measures to encourage a child to actually wash their hand, and of course praise them. So when they've done the right thing, that's wonderful, you've washed your hand without teacher telling you, so praises do wonders to children, positive reinforcement, positive encouragement. I think those are some of the tips.
I totally agree with you. Even adults love to be praised, right? We adults?
Yes, absolutely.